Hey everyone, my name is Emaan Chaudry.
And I'm Danielle Solish, and today you're listening to the 23rd episode of Seeing Clearly, which is our pre-clerkship guide to all things ophthalmology. On today's episode, we will be interviewing Dr. Helen Chung.
So, a little bit about Dr. Helen Chung. She completed her undergraduate degree in medical school at the University of Alberta. She then went on to complete her ophthalmology residency training at the University of Calgary and graduated in 2018. She currently works in Calgary as a comprehensive ophthalmologist and is also the program director of the University of Calgary ophthalmology program. And so, without further ado, we're really excited to introduce Dr. Chung here today.
Awesome. Thanks so much for inviting me. It's an honor to participate in this.
Yeah, thank you so much for coming. We feel very honored to have you here. So I'll just kick off right into our question. So we asked this to every single person that we have on our podcast, but I was wondering if you could kind of just tell us a little bit about your journey to ophthalmology, what drew you to ophthalmology and apply to ophthalmology.
Sure. So, I think in high school, uh, the summer between grade 11 and 12, I applied to the wisest, no, it was the Hires program. It was one of those kind of summer studentships, and that got me involved in research. First, it was a virology lab with Dr. Dave Evans in at the U of A, and then the following summers, I continued to apply for those summer ships and was awarded. And so I got involved with Dr. Orden Lehman, who is kind of a clinician scientist over at the University of Alberta. He practices glaucoma, but also runs his own ocular genetics lab. And so I did some projects with him through undergrad. And when I got into med school, I did the special training in research program with the U of A med school with him as well. And so just continued on from there. So that was from the basic sciences side. But then as I started to explore ophthalmology clinically, what drew me was all the innovation in the field and how delicate kind of the surgeries can be, as well as how much knowledge you need to have of like the two tiny structures of the human body, right? So it's just it really drew me. So
Thank you for sharing all that. It's really interesting to see how you had that kind of longevity relationship through, high school and undergrad, and then that kind of merged with your clinical experiences in medical school. It's nice to see that your two interests collided there, and then now here you are today as an ophthalmologist. So thank you so much for sharing that. I always find it's one of my favorite questions to ask. Kind of switching gears a little bit, and now that you're working in the field and as an ophthalmologist, you could tell us a little bit about your experience working in an academic setting and your role as a program director, and maybe a little bit about how you manage that role in conjunction with your clinical practice.
okay, so sure. Right now, I do work as program director as well as comprehensive ophthalmologist in Calgary. And this means that I have a full-time equivalent FTE of about 0.25 from the University of Calgary to do that role. I do find I use quite a bit more time though, put in evenings and weekends, but essentially my week is 2.5 days of clinic, 1 day of surgery, and the rest of the time as administrative duties, which includes paperwork and such from, the letters and all the things that are generated from the clinic, as well as answering emails and doing policy write-ups and especially over this past year, working on accreditation documents and things like that. So there's always a lot of things moving along to keep the residency program running. I do want to revisit because not just PD work. That's pretty recent. That was in the past 1.5 years. But before that, I did practice more of a community-based ophthalmologist. So just to compare and contrast the two experiences. So as a community-based ophthalmologist. For the first year, I had a surgical locum, and so I did both clinic and ORs, but this didn't come with any call or any other academic services that I need to provide. So for instance, I didn't teach residents. And then after that locum was finished, I was doing medical ophthalmology in the community, and so just working in the clinics. I did do kind of an RLE maybe once a month just to keep my skill set up, because I knew I was going to apply for jobs that did come with surgical privileges in the future, and so I didn't want to get rusty in those aspects. So with those, it was mainly just clinical work, and again, not much involvement with the program. So now that I'm PD, I find it's quite a big shift, and I would say probably I feel like half of my efforts are dedicated towards running the ophthalmology program here, and then the other half is for clinical stuff. So yeah.
I was wondering if I could just ask a quick follow-up question to that. What was it that kind of attracted you to, apply to this like program director role, a little bit more of an administrative role, rather than your, 5 days working? I guess it would have just been in, medical ophthalmology.
I mean, I do, like, now that I'm in the thick of it, I'm like, what was I thinking? But because it is a lot of work, but leading up to it, as you remember, I was heavily involved in research through training, residency, and all of that. And so as a clinical ophthalmologist, without that connection to the university, there wasn't as much going on. So I did want to get back into the swing of things, so to speak, in that sense. And then it's also fulfilling, involved in, training the next generation and shaping what the future is going to be like. And so it, I did, even before getting into this role, I was involved in the working group through the Royal College for the Competence by Design curriculum. Like we reviewed and created the EPAs, or the Entrustable Professional Activities, for the Canadian ophthalmology programs. And so very interesting. And with CBD starting its implementation this coming summer, it's really, I feel, rewarding to be, working on this and trying to push it through from the ground up. So.
Oh, that's incredible. It's definitely very nice to hear, especially since you had, like you mentioned, you only graduated in 2018, that even within this 5-year span, you've been able to kind of like transition within different roles, which just shows the flexibility of ophthalmology, and also, take certain interests and honestly act on them. And to be honest, it's, as you said, it must be so rewarding. And like for all students, it's like so important to have, a strong female mentor in this role. So that's amazing. And then I guess this is another bit of a shifting gears, my next question. But aside from ophthalmology, could you talk a little bit about how you have this balance between managing a career as an ophthalmologist, also in this program director role, but also having a family, a little bit about what it's like to take maternity leave in either residency or when you're a practicing physician, and just advice for individuals who are entering this field and hoping to start a family?
For sure. So just a little bit about me is that I have a 6-month-old at home now, first kid. And so that was also another new thing to try to navigate on top of PD, on top of accreditation. So I guess my first tip to anyone who's deciding to, start a family is that there's never really a good time, because there's always going to be something that comes up. And so you just have to do it. And, all ophthalmology programs across Canada, we're really valuing, the equality, diversity, inclusivity, and understanding the role of the parent, and trying to make sure that all of our trainees have that time with family if they need to. So I don't think that should be a barrier to considering starting your family. There are, yeah, it's just tricky. But I think as a med student, as a resident, when you take that time, the maternity or paternity leave, you do get the support, especially as a resident. I think you still get some pay, and so yeah, you can kind of delay graduation, but you then can have an earlier start on that family life, which can be really rewarding, right? And oftentimes I see a lot of my colleagues in the same situation. A lot of friends who went into programs that are shorter, starting their families, and their kids are all, 5, 6, probably not that old, sort of like 4 or 5 years old. And so now with my 6 month old, I'm like, oh, it's just it's a bit of a delayed start, but I do, yeah, I I don't know where I'm going with this, but basically just do whatever is right for you. Don't think about oh, what about the future? Oh, I'm gonna make myself look like I'm lazy or whatever. Like people have these fears in their mind about, letting down the program and whatever else, but I think just do what's right for you, and the program will make itself work so that it can support you. As a staff, I think it's even harder to take the time because now you've got your patients that you're responsible for. So my advice, if you're trying to do it as a staff person, is to get a locum and to take more time. So I took 3 months. I didn't get a locum, and so actually I was working part-time during my mat leave anyways. So don't follow what I do. Like it's like a do as I say, not as I do. Because now looking back, I was like, oh, I should have gotten a locum. I should have, maybe done 6 months off, and that would have given me a lot more opportunities to spend time with the kid. But I had a lot of family support, so my mom came down and is staying with us and helping out. So I think that worked out. Anyways, yeah, work-life balance. I don't think I'm the best example, but I think it's certainly an important thing that everyone should focus on, because when you start early having that balance, then it's only going to be easier down the road. Like adding more work to your schedule is easier than trying to take away from it, because then you're going to feel, that responsibility, that guilt, and whatever else. And so just keep that in mind.
Well, thank you for sharing all of those learning points that you've had and giving advice to our listeners. We haven't really touched much on, taking maternity leave during residency or as a staff. So that's really, really helpful for our listeners. We really appreciate it. If you don't mind me asking, just as a quick follow-up, how did you find the transition from, taking that time off and going back? I guess, you said you were working a bit part-time, but how did you find when you took a little bit of time off coming back and making sure you still had those skills and stuff like that? How did you find that transition, if there was one for you?
I don't think so, because 3 months is really nothing. I know that trainees, like even my current R5, they're like, oh wow, like I'm gonna take some time off to study, and then I need to get some like ORs in before I graduate. Otherwise, I'm gonna be super rusty. I'm like, these skills come back pretty quickly, and there's always gonna be mentors in any kind of place that you go to. I remember when I started, I had previous teachers reach out and go like, you know what, if you're feeling a little bit nervous in the OR in the first couple of days, like I'm happy to come in and join you for them. And so I think I didn't need to do that because I was doing, remember, like that RLE here and there.
Mm-hmm.
So I wasn't as nervous kind of restarting full slates. But if you are, there's mentors, there's wet lab, there's simulators, so you can get back in the swing of things. And I think after probably like 1 or 2 slates, you'll just be like, okay, it's like I never left. So don't be worried about that.
It's really nice to hear all the support that you've had and that exists in the ophthalmology community. So again, thank you for that. Transitioning gears a little bit, we know that you work with learners quite frequently. We were wondering if you had any advice for our learners listening to the episode.
Sure. So I think having a growth mindset through your training is going to be very beneficial. What that means is trying to take any feedback that you get, even negative feedback, and, applying it to make yourself a better person, and not thinking of it as a personal negative aspect of you. It's just feedback is feedback, and then you're just using it to become better. So that would be my advice, and I think that would make your journey through training a lot smoother and make you a happier person overall. So
oh, for sure. And I agree with that. I think that there used to be this more negative connotation around feedback or like constructive criticism that, this is more targeted at you, whereas in reality, like the point of feedback is to grow and to learn from it. And especially in a medicine where you're getting feedback all the time, it's like very important that rather than taking it personally, you're using it as almost like leverage towards your next step and towards like becoming the best possible physician that you can be. So I think that's wonderful.
Yeah. So like in medicine, we don't do it because everyone here is like type A personality. I'm the best. And if someone tells me to do better, then I'm a failure. That's not the case. It's that, if you see an athlete, let's say a high jumper, and their coach is like, move your leg an extra millimeter that way. That's not a criticism of that person. They're just giving them a technique to make them better, right? So I think we can all use that growth mindset, even, after training, as you are in practice, anything that you get feedback on from a patient, from a colleague, you can use that to make yourself better too. So
for sure. And it's honestly the best way to learn, like exactly like the example you gave, like someone didn't watch from an outside perspective and was able to, tell that jumper like which way to go, they're not going to improve unless they learn from someone else. So Thank you very much for sharing that. And that actually wraps up all of our ophthalmology type related questions. And now we end off very briefly with some 2 would you rathers. So I'm going to start first and then Emaan will ask one after. But I was wondering if you could answer this would you rather. So would you rather be able to see 10 minutes into your own future or be able to see someone else's entire future anytime you want?
So how many times can I see 10 minutes into the future? Like constantly or just once?
Just once.
I would rather see someone else's future, because if I see my husband's future, then I'd basically know my own. But anyways.
Oh, I like that. A loophole. Okay, the next question is, would you rather be trapped in a romantic comedy with your enemies or trapped in a horror TV show with your friends?
An interesting question. I don't really have many enemies, so I think I'd go with the rom-com, just so that at least we'll all be alive. I don't know.
Happy endings always. Exactly. Okay, well that's wraps up our entire episode. So I want to thank you, Dr. Chung, so much for being here. And I want to thank our listeners so much for listening to this episode of Seeing Clearly. Just a reminder, this is our pre-clerkship guide to all things ophthalmology, and you can stay caught up with iCurriculum by checking out our website, www.icurriculum.com, and also on Instagram, you can follow us at iCurriculum. Dr. Chung, thank you so much for being here.
Thanks again for inviting me. And just for everyone, if you see me changing hairstyles, backgrounds, all of that through these cuts, it's because my internet was really not working out for us during this recording. Thanks so much, you guys.
Thank you so much for being with us.